listening to A Voice in Central Kentucky. I'm your host, Melanie Williams. Today we will be discussing the programs geared to respond to the opioid crisis in Central Kentucky. According to the Kentucky Injury Prevention and Research Center, KIPRIC, in 2020, Kentucky had the third highest age-adjusted drug overdose fatality rate in the United States. Of those overdose deaths, approximately 81% involved opioids. Additionally, the proportion of Kentucky resident overdose deaths involving fentanyl has increased from 29% in 2016 to 69% in 2020. On today's episode, we will talk about a grant-funded program in our Lake Cumberland area that is working to reduce the morbidity and mortality related to opioid use disorder. The program has created a partnership of medical doctors, mental health facilities, detention centers, and the local health department. Today, I would like to introduce Susan Adams with the Lake Cumberland District Health Department. Susan has worked for many years in the grant-funded programs at the health department that relate to substance use disorders. She is currently the supervisor of the CARE program, the Comprehensive Addiction Referral Education. This program is grant-funded through the Kentucky Opioid Abatement. The CARE program assists those with substance use disorders. The program involves the health department, 5 county detention centers, and specialty courts. Hi, welcome Susan to the program.
Thank you. I'm very happy to be here.
Susan, can you tell me just a little bit about your program?
Sure. So with the CARE program, what our main goal is to help folks learn the things that they need to do in order to be able to transition back into the community once they've come out of incarceration.
Can you tell me what a typical participant looks like?
Our program mainly works with incarcerated individuals. Those individuals can range anywhere from 18 to 70. There's no determinant about substance abuse. It affects everyone, no matter the social status, the education status. So they could be from any walk of life, actually.
So how is somebody who is incarcerated referred to your program?
Once you are classified as a state inmate, you then can request from the Class D coordinator to be put into the classes that we offer.
What level of recovery would you classify the participants of your program?
I would consider them to be in recovery or in the early stages of what we call pre-contemplation or contemplation, which is the stages of change, because most of them are there on drug-related charges. Now, with MRT also, and you will hear me refer MRT as moral recognition therapy. It's just easier to say. We have escaping our prison. We have anger management, trauma, thinking for good, untangling relationships, portals, new direction. So those are the classes that are offered through our programs.
Susan, did you say that you offer parenting classes as well?
We do offer parenting classes too as part of under the MRT.
Is there an incentive for the inmates to participate in these classes?
When they complete these classes, they are eligible to get time off of their sentence.
What would a recovery from a substance use disorder look like?
Recovery from a substance use disorder comes in many different forms. I often tell folks that are in our class that recovery is going to look different for everyone. What might work for you may not work for your neighbor, and vice versa. So, recovery can be anywhere from going to a rehab facility for a number of days. It can be some people have tried to do excuse me, do it on their own by maybe attending meetings, getting some individual therapy, those kinds of things. Um, some people will try medically assisted treatment. Um, but the key to sobriety is people, places, and things needs to change. You have got to want sobriety, in my opinion, more than you want anything else in order for you to stay focused on the task at hand. So, like I said, sobriety can look different for everyone. For some, like I said, it's going to be going to rehab. And for some people, it takes more than one time going to rehab before they actually grasp it. Statistics tell us that I think it can take up to 7 times.
What are the challenges of providing a recovery program in a detention center setting?
Um, the challenges. Oh gosh, let me think.
I guess what I was
So
thinking here is that, it might be a little bit easier because they're in jail. So
yes,
they're not going
well,
anywhere.
and
You
that's
know what I'm saying?
true. That's true. Because if you were to have classes outside of the jail, you have no guarantees that you're going to have a captive audience or how many people are going to show up. So some of the challenges that I see is people just coming to class because they want to get time off of their sentence. Like they don't put the work into it like they should. Because I tell them you're only going to get as much out of this class as you put into this class. So, that is one of the challenges of I think sometimes they just come, and also I have them tell me all the time when they get to the end of like anger management or any of the classes, they will always say, I didn't think I needed this until I got in the class. And so I think they come into the class thinking, oh, I don't really need this. I'm just going to do it to get the time off my sentence. And then when they get there, they truly are impressed by the things they do learn about themselves.
Okay. How long are the classes?
The classes range anywhere from 8 to 12 weeks, depending on which class it is. Per DOC guidelines, each class is supposed to last no longer than an hour and a half.
You mentioned another class that you offer, which was called Smart Recovery. What is that?
We do another program called Smart Recovery, and that is a science based recovery, evidence based approach. One of the things that we wanted to do with Smart Recovery was reach out to the drug courts, the different specialty courts, and make them aware that we have a meeting that their participants can attend if they choose. It's not mandatory. And so we host those classes, or recovery meetings is what they are, at certain times in different locations throughout the week.
So is Smart Recovery external to the jail then?
We do Smart Recovery in the jail as well.
Okay.
So it can be done in the jail, or it can be done in a private setting, or it can be done as a group.
Do you provide any programs for the family members of the participants in your program?
We currently do not provide any type programs, unfortunately, for the families of those folks that are incarcerated or in rehab.
Okay. And we sort of touched on this a little bit with the SMART recovery, but do you offer your program to the community?
We do. We do offer it to the community. Anyone is welcome. Just because we partner with specialty courts, we welcome anyone in the communities that suffer from substance abuse that is looking for something to help. We welcome them to our meetings.
How would they find out where the meetings are?
Well, they could go to the Lake Cumberland District Health Department website. They should be posted on there. They also post the dates or the times on our Facebook page for Lake Cumberland District Health Department. Uh,
If someone has a family member they would like to refer to your program, can they?
um, by all means, if they have a family member that they think could benefit from anything that we offer, yes, they're more than welcome to share our information. Um, I'm not sure with what we do and the way that we do it now, as far as the classes, that we would have a lot to offer a family member, but we would definitely work with them to try to find a resource that could help them.
In your experience, what are some of the more common reasons that people have turned to using opioids?
Most time, trauma, and I know this is off subject, but with trauma, when people use substances, it's to self medicate because they haven't got the proper treatment, that they won't go and get the proper treatment to be able to get past the trauma in their life. So they self medicate. Instead of dealing with that, they bury it. And the sooner that you can come to deal with your trauma, you will find yourself getting better over time.
I think this will help people understand that, it's not necessarily that, you expect somebody to recover immediately because they go to one program.
Oh
I
no,
think
absolutely
people
not.
need to
Recovery is
understand.
a lifelong um, work. It is recovery. I tell people all the time, you didn't get here overnight, so you're not going to get out of it overnight. It's going to take work on your part to be able to move forward. So you will
I think
always
that's good.
be in recovery. Now,
Yeah.
will it get easier over time the longer you're sober? Absolutely, it will.
Susan, thank you so much for meeting with us today and giving us a little bit more information about the care program that's available through the Lake Cumberland District Health Department. Uh, would you like to add anything before we depart?
One thing I do want people to know is there is help. Don't ever think that you are down so far that you're not worthy of help, because you are. And you can recover if you work at it.